Hello everyone, my name is Dominic Mitchell, and today we're going to talk about Doula Magic, the prescription for positive childbirth, and this is a persuasive speech for my communications class. My introduction is, did you know that continuous doula support during childbirth could reduce the risk of C-sections by 39%? And this is by Decker 2023. And this shows that without a doula, women are 60% more likely to need a C-section in order to give birth. Also, here's a chart that with doula support, how much lower the number is than without doula support. The number is way higher. An additional part of my introduction is doula services provide birth support for expecting families, assist in improving health outcomes, share information, and should be integrated in normal healthcare plans, okay? After completing research and studying many birth reports, I discovered really impeccable data that shows the impact of doula care on maternal and infant health. And in this room, some of us may plan to give birth, some of us may have already had children, but the understanding the value of doula support can make a significant difference in the childbirthing experience. So first, I will share how doulas reduce unnecessary medical interventions. Next, we will look at how they promote a positive birth experience for the mother and the child. And finally, I'll address how doulas should be included in primary health care and public health care. All right, so starting out, my first point, doulas reduce the risk of medical interventions such as having C-sections, and this is evidence from a doula has been shown to reduce C-sections by 39%. This is Decker as well, and the American Journal of OBGYN confirms that continuous support from doulas decrease labor interventions, and that's by Hundlett in 2009. And also I have a photo of an article from USA Today about a child that had to get 13 stitches from being cut by getting a C-section. It was an emergency C-section that was done to the mom, but that's just one instance where having a C-section has also harmed the child as well as the mother. And next, my main point is doulas assist in creating a more positive experience by offering emotional support and physical support. And it's been written that women with doula support report feeling more in control and satisfied with their birthing experience. And this is by Boring in 2017. And these feelings are helpful in fostering a loving, caring, and uplifting environment for everyone in the household, especially when the mother doesn't feel anxious. And also, here's a review of a first-time mom highlighting her experience, and her name is Lana. Lana said that Christy and Jessica were fantastic doulas. They provided helpful information pre and post birth. They were quick to respond to any questions throughout the experience. Christy was with her during the entire time and coached her through long periods of early labor at home. Her husband and Lana and her husband met Jessica and Christy at the hospital, where they provided calm support and breathing techniques, position ideas, encouragement. They even gave her a massage. And as a first-time mom, she said her birth experience was more positive, manageable than she ever expected. Doula support definitely helped make me experience a more calm, comfortable, and empowering birth experience, and she wouldn't hesitate to recommend having a doula again. And this is just one instance of a first-time mom that really enjoyed having her experience with the doula. And lastly, my main point 3 is doulas play an important role in addressing racial contrast in public health care. And this is meaning that families of colors are less likely to have access to maternal care than our other counterparts. So this has more families of color looking to choose birth options such as at home or having birth centers, but insurance is still a problem. And this comes from the National Partnership for Women and Families in 2023. So moving forward with your help, we can change this and give all women access to maternal health care, no matter the race or the job they have. And we can make sure that we include doulaship as a part of the overall public health care and giving all women's right to have health care when they're pregnant. And this also is a graph that just shows that Black and Native American women are 60% to 65% more likely, or less likely rather, to have public insurance that help them with delivering their children. And in conclusion, doula support is monumental for reducing medical interventions, promoting a positive experience, and addressing inequalities in maternal health care. Today we've gone over how doulas lower intervention rates, how they contribute to better birth experience, and how together we can impact the access to health care for all expecting mothers. The benefits of including doula care in public health care, it aligns with the need for better maternal health policies just in general across the board. And my call to action is everyone can support the inclusion of doula services in healthcare plans by talking to their healthcare provider and talking to them about including doula services in primary health, asking for policy changes with your local representatives and the people that you vote for, spreading the word on benefits of doula care to people that will listen, and connecting with local doulas and supporting the people that are already doing the work. In closing, what if every mother could have a compassionate and supporting environment to give birth? They would be more like Lana, who had a positive birth experience with her doula, and several other moms that have had this experience. I hope you see now how doula support can transform childbirth experience for the better. Thank you. My name is Dominik, and these are the sources that I utilize for my presentation.